Hello, my name is Tattarida Moonmirat.
Hi, my name is Jitlada Inthayam.
Today I will talk about case study presentation. Research question. First, what are the causes of premature pregnancy? Second, is the premature pregnancy adversely affect of his own parents or children? How does it affect? Third, how the family's behavior affect children? Thesis statement. The research paper will analyze a situational in adolescent pregnancy and adolescent parentage. It has summarized important laws and policy affecting pregnancy of teenagers in Thailand. It also identifies the main factor hindering the prevention of pregnancy and seeking care. It's also identifying practices such as pregnancy prevention measures linking to care and service. Introduction. Adolescent pregnancy is a pregnancy that occurs in women younger than 20 years, which the World Health Organization has determined about the rate of pregnancy among adolescents or women under 20 should be less than 10%, as this is the period when the body is not fully matured. Mind and emotions are not stable enough, not graduated, they do not have a career and income of their own. This is the age that is not yet equipped with maturity, economics, status, and potential for making decisions in life, and still lacking readiness in many areas. Therefore, not the appropriate age to have a family or a child to take care of. Literature review. Adolescence is an age that has become interested in sex, especially the opposite gender, start to love, interested in sex, or having a boyfriend according to current social value that may lead to premature sex and unwanted pregnancy in the future. Second, changes in society and culture in various fields. Women's preference is an early question of the broader social impact system, and in prayer is decreased due to error setting problems caused by a number of issues, such as the problem of all aspects of socio-economic education, setting allowance, and can affect both physical and mental health, so that care set up, care and system-wide solutions are addressed. Third, Thailand tends to increase the number of pregnant women and the tendency of the age of pregnant women to decline. In 2012, there were an average of 374 pregnant women under 20 years of age per day, or 15 pregnant teenagers per hour. Method. For the determination of research methodology by using qualitative research methods with the documentary research process. Initially, the research team has carried out the research process in accordance with the regulations. Research method of research methodology by using qualitative research methods with the process of studying and analyzing information from documents or documentary research by reviewing the concepts, theories, and literature related to process to promote public participation. This begins with a study of preliminary text on the implication of philosophical concepts and their meanings.
Main point number 1. The major problems of adolescent pregnancy. For case number 1, adolescence is the tension between childhood and adulthood, characterized by both anatomical and physiological, and also social growth. In this period, it is an age that is curious, wanting to try something new and ready to learn new things. When the body changes to fight puberty, including adolescent girls begin menstruation and adolescent males begin to produce sperm. If you have unprotected sex, you risk and causing a premature pregnancy. The main factor contributing to teen pregnancy: lack of knowledge and misinformation about sex and method of contraception that contribute to adolescent pregnancy, and also not knowing how to use condom and pills correctly. Third most common reason were ineffective contraception, indicating inadequate information on birth control, lack of understanding, and lack of communication about sex. This cultural stigma affects birth control and adolescent sexuality, which may also limit access to contraception. Similarly, cultural norms can be misleading about teen pregnancy. Wearing provocative clothing triggers teen pregnancy. On the family side, relationship between parents and adolescents controlling and having rules in the family, including divorce problems, violence within the family, lack of love and warmth in the families. Therefore, teenagers can be easily persuaded in the wrong way. Other factors, such as type of media that contain sensitive and inappropriate, it can lead to teen pregnancy. In addition, there are also risk factors such as internal factors like physical and mental aspects of adolescence, knowledge and family attitudes, and another thing is external factor is community or society, and these are cause the pregnancy. For case number 2, new values of adolescent girls in Thai society, showing provocative behavior with a verbal expression of satisfaction demanding the opposite sex, that like a net idol through the social media to a wide audience. So there are teenage girls who want to seek attention to imitate behavior. Value one night stand, it refers to the overnight sex behavior of men and women who are not familiar with each other but who feel attracted to each other and agree to have a sexual relation without having to be a lover. Cool and charming. As for adolescent boys, the ability to have sex indicates that they are manly, including having sex before marriage is normal, and teenagers still lack awareness of contraception. Community and society is also the reason that can cause the pregnancy. Family migration from rural to urban areas, including seeing people around you or seeing people in the same community having sex prematurely. Seeing the behavior of the people around you like this, they see it as normal and copy behavior occur. Next one is main point number 2, is the effects of adolescent pregnancy. For case number 3, naturally teenagers will have growth and physical integrity, causing a very high reproductive readiness. Pregnancy when both parties are not ready can cause a lot of problems. Both adolescents their family, the economy, and the society. This pregnancy problem greatly affects the future of adolescents. It also impacts on adolescents both physically and mentally. Most adolescent girls who are pregnant are in the process of study. When there is a pregnancy, the adolescent can no longer study and resulting in having to leave the school, which means that the future of learning will be completely gone. In some cases, it is decided to have an abortion to terminate the pregnancy in the hope that it will be able to return them to normal life as usual. In fact, abortion is illegal. It had a huge impact on health as well. In some cases, a non-medical abortion can be dangerous to health or even death. Some people are unable to get pregnant again, and it also affects physical and mental health. Adolescent girls who are pregnant often worry about the kids. Some people have stress and depression because they are not ready to raise children. Think about whether the male side will be responsible or not. What will your parent think? It can cause sorrow, anxiety, and stress. For case number 4, when adolescents become pregnant, both adolescents must marry without any readiness for marriage, and child rearing caused family problems. There were quarrels or even violence that eventually led to a divorce. Sexually transmitted infection. Sexual intercourse can lead to STDs, especially HIV. It is a disease that is spreading and causing serious social problems. It is also a disease that does not have a cure for it, and there is no vaccine to prevent this disease being infected with HIV. And it also causes health and social problems, and it destroys the future of adolescents as well. It also damages the family reputation as well as increasing costs and divorce problems, including affecting society such as abortion, sexual transmission as well. It also damages the family reputation as well as increasing costs and divorce problems, including affecting society such as abortion, sexual transmitted disease, cultural deterioration, and low population quality. For the main point number 3, family behaviors is affected in pregnancy. For case number 5, adolescents who do not living with parents, lack of care or communication, especially in gender issue, create a gap in the discussion of sex between family members. Families should advise teenagers to stay away from premature sexual and pregnancy by laying the foundation for conception. It takes for teenagers since childhood in a gradual way. Teach and talk about proper behavior and teach them to knowing the value, loving yourself, loving the future, and knowing how to differentiate the good and the bad. The important thing is to teach them to refuse to have sex in different situations. This is a preventable problem if these teenagers are instilled in the right ideas and values from childhood. Next one is case number 6. The relationship between parents and adolescents control the regulation in the family, including problem of divorce, domestic violence, lack of love and warmth in the family, can result in adolescents being persuaded easily in the wrong way. Families should have a positive attitude and communicating sex with their children to prevent and result in pregnancy problems. Family members should have a good relationship and have a close relationship, love and understanding each other, and there is an atmosphere of love and warmth. Especially father and mother are able to talk to children about the relationship of the opposite sex, make teenagers have a confidence to talk about sex and feel that they are accepted by their family. Next one is discussion and conclusion. Adolescent pregnancy is a big problem in Thailand that affects society as a whole. Nowadays, it tends to decline quite slowly because the problem of teenage pregnancy is affected to many problems such as the problem of adolescents themselves, family problems, education problems, or economic problems. To prevent problems, sex education should be taught in school so that adolescents can understand and apply it. Parents should also be mindful of adolescent sexuality by teaching them about the effect of unprotected sex, about a premature pregnancy, and something else that is about the pregnancy. And community and society should pay attention to this problem because it is the big problem in Thailand, as well as government agencies should have guidelines to prevent and solve problems in order to reduce the problem of pregnancy among Thai adolescents. And this is our reference. So, thank you for watching.